by providing quality healthcare services to serve the community.
First of all, the desire to drive towards quality and patient safety and customer satisfaction is all driven from the top, the management, the leadership team. And our CEO, Adam Thompson, took on board the desire to drive towards pre-qualifications, etc. So it was from there that everybody accepted the concept of driving quality and patient safety and looking at the customer, the patient, and how we can improve.
From all your complaints, I would just have to go and check and have a good examination of your mouth and know what's going on there. Is that good?
It's not about just letting people talk to a doctor. It's making sure that there's an entire infrastructure and systems that support that doctor to make the proper diagnosis, give the proper care, and then follow up to make sure the patient is having the appropriate outcome from that care.
We need to cut off that excess bone that is covering the elastic so that the teeth will be exposed.
For JCI, it's a total team effort because everybody has to be on board and have the same aspirations for quality throughout the organization. And it's a continuing process of training, of education, and as I say, improving on the improvements. And it's driven by the management, right from the top, from the leadership team, right through departmental heads, through managers and people within the organization. So we're in communication with everybody. We have very open management follow-up meetings on JCI audits and improvements to make sure that everybody understands their part within the process.
The journey for EHA clinics to the JCI accreditation, so for Joint Commission International, we started this process almost from day one. We knew from day one we wanted to follow a quality framework. It's kind of like standing at the base of Everest and looking up, and you just say, okay, this is going to be a long journey, so we need to kind of set the framework for how we're going to get there. And we had a lot of kind of stops and starts where we kind of got the process going and we realized, wow, we can't even continue with this because there's a bunch of stuff that we need to then put in place before we can even continue on. So we had to rethink our whole recruitment process and say, okay, we need people not just with the technical skills, but with the mindset around quality, the willingness to do teamwork.
JCI accreditation was a long journey. Major highlights are the teamwork that we had at EHA clinics. Every single team member at EHA clinics participated to have this accreditation done.
I think you have to look at primary health care as a gatekeeper. Failure of primary health care is what results in people having to go for tertiary care. Making sure that our hypertensive patients are now coming down with situations where they now need, put in a stent and things like that. I think that is the place where we can win. Nigerians make a very large part of most of the established Western healthcare system. So obviously we're doing something right. We are bringing up healthcare staff that people want to recruit from Nigeria. So we're definitely doing something right. So for all the people who are running to the UK for treatment, your nurse is probably going to be called Biola.
Hey dear, how you feeling? Okay, can I just take your temperature? There we go. Boop. Boop. Oh, that's all right, should be okay.
At EHA clinics, we make sure that we purchase top-notch equipment that can offer a wide range of services. So we have calibrating plans, we have maintenance plans that we use to ensure that at every point in time, patients are confident that the records that they have with us are accurate.
In terms of quality at EHA clinics and the level of quality that any patient expects to get, it's one of our core values. So, and one of the things that we monitor closely to ensure that when patients come in here, they're safe and that their care is reproducible.
We looked at the entire system of what it was going to take to deliver quality care, and we kind of built that from the ground up. So when we started EHA clinics, we even looked at the facility itself. You know, how do we actually get a proper facility that has things like air filtration built in the air so that as sick people come into the clinic, they're not spreading their illness to people sitting next to them. Quality is not an endpoint, it's a journey, and it's a constant journey. So you can't ever say, okay, well, we've reached quality, now we're okay. It has to be this continuous improvement. So we invested a lot of time and money in making sure our staff became certified by the WHO.
We want to ensure that we are implementing quality systems throughout our organization, right from our primary healthcare clinics through our pharmaceutical distribution, and every element of the business that we expand into. We are looking at primary development and opening new clinics in Abuja, in Lagos, and also in the east. Into, we are looking at primary development and opening.
So what does the future hold for EHA clinics? The future of EHA clinics is really to access affordable, quality healthcare. If our dream came true, we would be in it. You know, we'd have at least 50 clinics, you know, in the next 5 years around Nigeria. We want to open up access to other parts of care, not just focus directly on the kind of primary outpatient care. We're looking at launching services to give people access to mental health, where that they can access their mental health and get counseling directly on their phone or on like via a website. The minimum standard of care should be access, affordability, and quality.
Hi everyone, good morning. Please confirm that you can hear me, anyone? Can anyone hear me?
Yes, we can hear you.
Right, thank you, Elijah. Thank you everyone that has joined. You can please use the chat box. I've put in the link for this if you have colleagues or friends that are yet to join. We can use the next few minutes to send it across to them. Just introduce yourself, tell us where you're joining from, and we'll be glad to have you. You're welcome once again to EHA Clinics Academy for this webinar today. I hope you're having a restful public holiday for those of us joining in Nigeria. It's another public holiday, I think, to celebrate the Eid event for our Muslim colleagues. So thank you all for joining, please. I can see Blessing Bright. Oh, this is like the Blessing Brights that I know. Victoria Apan, and many of us. All right, thank you for joining. Today we're treating something we consider to be a very important topic because we're dealing with women. The last few weeks, it's been a lot about women the world over. We're either celebrating them as women or as mothers. And well, it goes without saying that women play a very, very vital role in our lives. Everyone has a mother and then perhaps has a sister, you know, and eventually perhaps would be married to a wife, well, for those who are straight, I think, right? So, and then there's this very important aspect of women's health, which is, you know, they are what I would like to call their monthlies. And today we want to look at what we will title the silent burden, you know, heavy bleeding and fibroids and our particular focus is in African women, right? And we've invited a very important personality who we consider an expert in this area. As a matter of fact, has even written a book that addresses this area. I'll allow her to talk about that later when she comes up. All right, permit me to just tell us a little about our speaker today. Her name is Dr. Ivy Ilonzo. All right, briefly, I'll just read about her. So Dr. Ivy Ilonzo, a medical doctor, is a physician and a public health specialist and founder of the Ivy Health Foundation, a platform where medicine meets education. She has a mission to reshape how women approach their health. Dr. Ivy is passionate about empowering women with knowledge, confidence, and clarity in a world overflowing with medical misinformation. Her journey began in clinical medicine but expanded into public health, where she witnessed firsthand how gaps in healthcare, especially for women, deeply um, affects lives. So rather than treating symptoms alone, she set out to address root causes, challenge stigma, and advocate for change, particularly within African communities. Dr. Ivy has led multiple initiatives to close the gap in women's health education, from hosting webinars on hormonal conditions like PCOS to mentoring young women in health advocacy. She's also the author of Is My Bleeding Normal? I'm sure you know why she's the best person for this webinar today. It's a book that is currently used for educational purposes to support menstrual health awareness and learning. And the heart of her work is one goal: ensuring that every woman feels heard and informed. I hope that gives us a little snippet of whom our guest is. I'll allow her to just say hello to us, Dr. Alonso. Hi, Dr. Ivy.
Good morning, everyone. I'm so excited to be here, and I want to thank the EHA Clinic Academy for inviting me and giving me the opportunity to share knowledge. I hope at the end of this, we'll all go back with more information on something we already know. Thank you.
Thank you. Thank you. So Dr. Ivy has welcomed us. I hope you can also quickly use the opportunity to invite your colleagues. So while this webinar is ongoing, just for order, we have muted everyone. So you won't be able to speak until we give you the opportunity to speak. And Dr. Ivy has arranged this session to give room for interaction. So if you have to, except you have to speak, but when you have to, you can just raise a hand. If you look at the lower area of your Zoom, if you're joining us via Zoom, you can raise a hand and we may give you an opportunity to speak, although that will be later on in the webinar. For those who are joining through our YouTube handle, you can just drop a chat and myself and my colleague Agatha will be able to read out what's going on there. So please, for the next about 45 to 50 minutes, Dr. Alonso will be sharing with us what we need to know. I would suggest if you have a pen or a paper, just write down. If you already have questions that you planned to ask in this webinar, you can use the Q&A section and just drop it down. We'll take note of that. And perhaps the questions come as a result of some of the things that Dr. Ivy will be sharing. We will give opportunity for that to be clear. So right now, I'm going to hand over the microphone to Dr. Ivy. Hi, Dr. Ivy, please, over to you. Thank you.
Hi, everyone. Thanks again. We'll just jump straight into the topic. Like you said, if you have questions, if there's something you're not understanding, or if you feel like maybe what I'm saying sounds too, technical, or the language I'm using is not so clear, please put it in the chat and they'll draw my attention to it. I would always clarify. So I'm going to be sharing my screen now, and we'll just jump right into it. Can we all see my screen, please?
Sure, we can.
Yes, we can.
Okay, thank you. So the title of today's webinar is actually the silent burden, heavy bleeding, and fibroids in African women. So it's a very important topic because I'm sure if we all look into families here or friends, you'll be able to at least pick 5 people you know who is currently battling with fibroids or who is currently battling with heavy bleeding. So it's a very important conversation because fibroids are one of the most common gynecological conditions affecting women worldwide. I know there's a thinking behind if like maybe it just affects only Africans. Yes, it affects mainly Africans, but it also affects other ethnic groups. So today, that's why we are actually we have to talk about this. And I'm sure recently you've been seeing a lot of trends on this particular topic concerning the popular actress, which I would still talk about later. So we'll explore the science behind fibroids and the impact on fertility and quality of life, and why African women are affected mostly. Um, I'm just going to tell you a little bit about myself. So, my full name is Dr. Obianuju Ivy Alonso, but people call me Dr. Ivy, which is easy, which is shorter. I'm a medical doctor, a public health specialist, and a women's health advocate. I'm leading initiatives through DV Health Foundation. It's an organization dedicated to improving women's health and well-being. So my work spans the spectrum of women's health, from menstrual health education to awareness and prevention of gynecological cancers. So I'm also the author of Is My Bleeding Normal, that talks about everything bleeding, everything that causes bleeding in women. So that's what the book covers. So today we're going to be focusing on what uterine fibroids are, the who's affected most, the heavy bleeding crisis, the risk factors from diagnosis to treatment. So we're just going to cover everything today. So why is this topic important? It's obviously important because um, I think we tend to normalize heavy bleeding a lot. So because, some people just feel, if you ask someone, how is your oh, yeah, I usually have heavy flow. I usually have heavy flow. They just think it's a normal thing, and because of that, they don't think it's important enough for them for you to check. So that's why we kind of have delay in fibroid care, because people just normalize heavy bleeding. So normalizing of heavy bleeding, fibroid onset amongst African women, we tend to start earlier. It happens earlier for African women than other ethnic groups. African women face greater fibroid severity. That's why you'd hear, maybe within African communities, you hear someone had about 50 fibroids, and you're just wondering, like, how, why? It happens more with Africans. The cultural beliefs and limited access hinder timely diagnosis. Like I said, if people just feel like it's normal to have heavy bleeding, they don't need to check, and then by the time it now becomes worse, it's maybe it would have multiplied, and it would have affected the uterus a lot, that diagnoses and treatments will now be as effective. So fibroid awareness in Africa is a public health priority, because we need to start looking into it. The line objectives today, like I said, to define fibroids and their types, explore key biological and hormonal drivers, and recognize the link between heavy menstrual bleeding to fibroid. Then also analyze the racial disparities and review diagnoses and all. Before I go on, I would like to understand my audience, to know my audience, just so that that would help me to know the type of language to use, even though I plan to make it as simple as possible, because I know we have the general public here. So please, can you pop in the chat word which best describes you? Are you a health professional, a public health professional, or a student, or you're just someone who is interested in learning more about fibroids? Just to give me a quick understanding of okay. If you've done that, please just wave. I just need a little wave, just or you don't need to write the full thing. All you just need to do is put A, B, C, or D. Okay. I can see we have health professionals. Okay. Nice. Okay. Thank you. So that means I'm good to go then. I would then continue. Okay, like I mentioned, I'm sure we saw this trending video on social media about the actress Lupita. You know about her story. So in 2024, in 2014, actress Lupita revealed that she had surgery to remove her uterine fibroids. So uterine fibroids means it's just still fibroids. Uterine is a medical term for uterus. That's the womb. Just to break it down, I don't want you to feel like I'm using too much medical terms. So uterine fibroids. In the same year, she won her Academy Award. So doctors removed about 30 fibroids during her surgery. Then later on, I think recently she came out to say that they've come back and then about 15. So now her story highlights how common fibroids are and shows that they affect women across all backgrounds. So it's not about maybe for some people would say Nigeria happened to me, or no, it's not about location. It's about it affects everyone everywhere, and all backgrounds and all. So even those with access to excellent healthcare, wherever you are, fibroid is not about location. So by sharing her story publicly, she helps raise awareness about fibroids and women's health. Now, going straight into it, what are fibroids? Uterine fibroids are benign tumors made of smooth muscle cells that develop in the uterus. So they arise from the myometrium. Myometrium is the muscles of the uterus. Uterus is the layman term, is the medical term for womb. So they arise from the muscles of the womb, which is the muscular layer of the uterus. Fibroids are hormone responsive tumors, meaning they grow in response to estrogen and progesterone. So these are female hormones that we have in our body naturally. So they feed on these hormones to grow. So studies estimate that up to 70 to 80% of women develop fibroids by age 50. Although only about 25 to 30% develop symptoms. So that's to show you that a lot of people have fibroids, but they may not know because they are not symptomatic. So when I say symptomatic, it just means that the fibroid is just there, but it's not causing any issue. It's not giving them any problems. So they don't even know that it's there. So some people may just go to just do maybe an ultrasound for something else. And then the radiographer will say, oh, you have fibroids. And you just be surprised because you can't feel anything. You're not having pains or whatever. But it just means that the person has fibroid, but it's just not symptomatic. So we have different classification of fibroids. Please, again, if you have any questions, is either you just write it down so that you remember to ask, and then I'll always come back to this. So we have different classification of fibroids. I'm not going to give you too much details on the types, but I'll just give you the general classification. So we have I'm going to use a pen to point it out. Can you see my laser? Yes. So we have what we call the submucosal fibroid. They grow into the uterine cavity, that's into the muscles of the uterus. Into the cavity of the uterus. Then we have the intramural fibroids, which grow in the wall. That's like this one. This is more of the muscular one. And you have the subserosal fibroids that grow outward from the uterus. And then pendicular fibroids that are attached to the uterus by a stalk. And that's this one. Okay? So location determines why I'm taking out time to explain this is because location determines how fibroids affect bleeding and fertility. And also it also determines how it can be treated and managed. So what causes fibroid? Till now, the exact cause of fibroids is not fully understood. But however, several factors are associated with fibroid development, including hormonal influences, like I mentioned earlier. That's the progesterone and the estrogen. Genetic factors also play a role. The genetic factors and family history. If there's a family history of fibroids, that also could determine if someone will have fibroids or not. Vitamin D deficiency, obesity, and African ancestry. African ancestry doesn't mean that that means every woman in Africa would have fibroid. No, but it's just that later on, I'll tell you why it's kind of more frequent and it has more severe symptoms among African women. And then nulliparity also nulliparity can also cause fibroid. So now nulliparity, it means if someone has not had a child before. So not having a baby also can increase the risk of having fibroids. I know that sounds strange, but I'll also explain later. So these factors interact in complex ways and contribute to the growth of uterine fibroids. So there are common symptoms which we all know. The heavy menstrual bleeding is the number one. That's excessive blood loss, the most common, and it affects a lot of people, also impacts on daily lives and energy. So now the reason why it impacts on daily lives and energy is because heavy bleeding also can lead to anemia, which I will also explain later. Frequent urination, if the fibroid is too big, the pressure from the fibroid, the weight of the fibroid can be resting on the bladder, which will make it difficult to empty the bladder. That's why you would have urgent need to urinate. Back and leg pain, obviously the persistent back pain, and there'll be persistent back pain and all because of nerve compressions, and that's the weight of the fibroid. We have pelvic pressure and pain. We have constipation. So all these symptoms are very, very easy to for you to understand, because if you have, it is just almost something, it's just similar to someone having a baby in their womb. The weight of the baby would obviously press on the bladder, the weight of the baby would, but the only difference is that it won't cause heavy bleeding like fibroid does. So imagine having this and it's not like you're expecting a child. At least pregnancy will resolve within a specific time, but this just continues without non-stop, without stopping. So the clinical impact of fibroid is so we have that, like I said, 30 to 50% of women with fibroids experience heavy menstrual bleeding. And fibroids are among the leading causes of hysterectomy globally. So hysterectomy is the removal of the womb. So fibroids, people just because of how severe it is, they just decide, okay, there's no point. Let me just take out the womb entirely. 40 to 60% of women with fibroids eventually require treatment. And then myomectomy preserves fertility. Myomectomy is taking out the fibroid instead of taking out the whole womb. So now I showed you the different locations of each fibroid. So it depends on where the fibroid is located. You can actually take out just the fibroids and still have the womb intact, which means that fertility can still happen even after the surgery. So complications of fibroids, obviously there's the anemia, the pelvic pain, and infertility. And also pregnancy complications too can occur. So what is heavy menstrual bleeding? Today our topic is heavy bleeding and fibroids in African women. So the reason why there's much emphasis on this heavy bleeding is because of how normal we think heavy bleeding is. So I've heard situations where people just feel, okay, if I want to go buy a sanitary pad, do you have heavy flow or light flow? Like you just take it as it's we all have different flows. So mine is heavy, so I just use the heavy one. But people nobody wants to go further to check, why am I having heavy bleeding? Is it normal? So having heavy menstrual flow is actually not normal. So please, if you have heavy menstrual flow, try, even if it's just to go check it up, either do an ultrasound or just go see a doctor just to know why you're having heavy menstrual flow. Don't take it casually. So excessive between 30 to 50% of women with fibroids experience heavy bleeding, like I said, and it can lead to iron deficiency, anemia, chronic fatigue, reduced work productivity, and increased healthcare visits. So it's obviously, if there's iron deficiency, anemia, you're going to be having fatigue all the time, and then you'd just not feel healthy, and you want to go every time to go to the to the hospital to check yourself, but you won't actually, you're not looking at the main cause. You're just checking, okay, I feel weak. Oh, there's anemia and all that, and they're just treating it instead of actually treating the main cause. So fibroids are also among the leading causes of this heavy menstrual flow. So I'm not trying to say that everyone who has heavy menstrual flow has fibroid, no. But there is a high chance that someone who has heavy menstrual flow would have fibroid. So it has, like, it kind of obviously affect career. It can affect relationship. I'm not, without giving off much information, I think I've heard cases where weddings were turned down because maybe, during the pre-wedding test and check and all that, maybe the man finds out that the woman has fibroids. Men obviously don't understand that with fibroids, you can still have babies. With fibroids, just depending on the location, you can still have babies, and you can also take out the fibroid and still be able to have babies. So they don't understand that. All they just know is, oh, she has fibroids, and then they take off. So weddings have been called off because of, maybe like, because they heard the lady has fibroids. So it has affected a lot of relationships. I'm sure if I ask questions now, you'll be able to tell me about 2, 3 people that their weddings were called off because they found out that the lady has fibroids. Okay, sorry. Give me a minute. So we're going to be talking about fibroids and infertility. Fibroids can affect fertility depending on their size, number, and especially their location. So I described earlier on about the different classification of fibroids. So submucosal fibroids are the most clinically significant because they distort the uterus. They distort the shape of the uterus and all. And they interfere with embryo implantation. So obviously, for fertilization, for you to have a baby, you need to have embryo implantation. So fibroids may also affect fertility by altering the uterine blood flow, increasing inflammation, and changing gene expression in the uterine lining. So anatomical distortion and blockage, submucosal fibroids, like I said, is the highest risk. And also fertility can also be preserved through myomectomy. Myomectomy is taking out the fibroid alone and not taking out the whole womb. And early diagnosis and outcomes also helps a lot. So do fibroids cause infertility? Yes, I think it feels like I'm repeating myself, but I just want to clear the air because of the impact it has on the mental health for women. So like I said, the location is the key factor. Because if they depend on location, it can be, if some fibers can be near the openings and can physically obstruct the transport of sperm and egg. And also impaired endometrial receptivity, altered blood flow, and lining quality reduces implantation success. So now this particular one can also affect IVF. So for those who want to do IVF, that's the in vitro the IVF. For those who want to do it, it can impair the endometrial receptivity. The size amplifies the risk. Larger fibroids compress tissue and disrupt contractions and all. Intramural fibroids and pregnancy loss. So now, I mentioned the different types and I talked about the intramural fibroids. So intramural fibroids are obviously if the baby cannot be competing with the fibroids, because it's like the baby is in the womb, the fibroid is there, they are growing, the both of them are just there growing and all. It would affect the baby's growth in the womb, and sometimes it can also cause pregnancy loss, depending on the time of the pregnancy. So this is just a clear picture of how it happens. So that's instead of the space the baby is supposed to use to kind of grow in the womb, the fibroid distorts it occupies the space and then reduces the blood flow to the baby. It can also cause blocked fallopian tubes and compression. Compression prevents sperm from reaching the egg, like I mentioned earlier. Sorry, I'm just repeating myself here. So that's what this is just me giving like how the impact of the location. So submucosal, there's fertility threat. If they're intramural, there's moderate impact, and subserosal, we have the least risk with subserosal. Subserosal is just this one on this side, but the submucosal is the one that has a high threat. Sorry, can you see my laser? So this has the highest threat. This type of fibroid would cause it's also implicated in heavy bleeding too. Having submucosal fibroid also is the one that also causes heavy bleeding. Subserosal is the least one that would affect infertility. So this is just me explaining how how it affects how it affects the uterus. Vascular and inflammatory changes, abnormal angiogenesis in fibroids. There's sorry, give me a minute. I'm still trying to explain. I don't want to bore you all with medical terms. This is the tubal and the sperm transport disruption that I mentioned earlier. It also affects IVF. So the indirect fertility effects of fibroids. So there's iron deficiency, anemia, that's heavy bleeding that depletes overall health and energy. There's dyspareunia and intimacy. So now this dyspareunia is just simply painful sexual intercourse. So painful intercourse will disrupt sexual activities and obviously will mean likely chance of having a baby is very low because there's no adequate sex. Weakened uterine lining, anemia limits endometrial receptivity for implantation. Chronic anxiety, consistent psychological stress impact hormonal regulation. So stress, obviously, and hormonal regulations are linked together. There's delayed family planning because there's fatigue, there's pain. So you're just not interested. Having you're not in the right frame of mind to have a baby. And that way, mentally, you're just tuned off and you won't want to try or to even do anything to or plan towards your ovulation and all that. So it obviously influences your key decisions. The emotional impact of fertility, of fibroids and heavy bleeding. We have there's shame and silence. No one wants to talk about it. If you know you have a fibroid, you may not want to tell someone so that the person won't tell someone, and then it would affect your chances of getting married. You know that mindset. So they may just want to keep it to themselves. They have relationship strain, depression and anxiety, work and social withdrawal. So having heavy flow, getting stained all the time at work or getting stained all the time in school, you just don't want to you don't want to do much. You just want to stay home. So imagine someone who has heavy flow every month, and you're thinking, you're wondering, if I go to work now, there's a chance I'll get stained, or I don't have the energy to start cleaning myself at work, or there's no clean toilet at work. I don't think I want to just do this. You may just call the HR and ask for a day off. So are you going to be going off every month? You know, that kind of thing. Or you won't want to go to school because, oh, there's a public toilet there. If I stay in the toilet or if I stay myself, people are going to laugh at me, things like that. There's also community stigma, and we always assume that having fibroid means the person is old. Because, growing up, we used to think that, it's our aunties that used to have fibroids. So fibroids are for like a bit of the older women. But the truth is, I've actually seen younger people have fibroids, because fibroid actually happens within the reproductive age, which is between 60 to 50. They say 50, but it's usually between 60, just during your reproductive phase. So between 16, so I hope you're not hearing 60, 16 to 15. So there's community stigma. Because of that, you want to go breaking the cycle. So you have to overcome the stigma and access treatment. So the epidemiology of fibroids. Fibroids affect about 70 to 80 percent of women worldwide by age 15. For African and African descended women, why I said African descended women is because obviously for even those in America, the Caribbean, they experience earlier onset and larger tumors. And then they have more severe symptoms. They are heavy bleeding and all that will be more amongst African women. And we also have a higher rate of surgical treatments among African women. So, for example, if you go to a country like the UK, yes, we have Africans in the UK, but having a myomectomy may not be as common as it would be to like having a myomectomy in Nigeria. So, why I say so is we have more Africans like we have more Blacks in Nigeria who would naturally have fibroids. So that kind of surgery would just be a common thing in Nigeria. But in the UK, I mean, in a week, they may not have it. If you have 50 myomectomies in Nigeria in a week, in the UK, you may have maybe 10 or 20 because it's not so common. And yeah. So let me just want to be sure that I've covered everything. Okay. So why African women are more affected? So like I said earlier, African women are affected more, and they most times develop fibroids earlier in life. The fibroids may be larger or more numerous at diagnosis, and symptoms such as heavy bleeding and anemia are more severe. So studies have shown that higher rates of surgical treatments, including hysterectomy, actually happens amongst African women. And this can mean long-lasting and lasting burden on daily lives and fertility. But the interesting part is that all the research they conduct, they usually don't use a lot of African women for this research. So that's why till now we still have inconclusive cause for these of what causes fibroids and why we Africans have it more. So barriers in African settings, we have women face multiple complex barriers to care, including limited access to diagnostic imaging. They have high cost of treatment, fear of hysterectomy, and limited availability of fertility preserving surgical options. So sometimes it just depends on where you go to, or if you're just told that there's no point taking out the fibroid, let's just take out the whole womb, then find that's why a lot of people are actually afraid of going to check it, because they just feel like it's either you're told we'll take out the fibroids or we take out the whole womb. And then also the fear of having hysterectomy, going through general anesthesia, and or maybe they must have heard stories of a family friend who died having a surgery, a fibroid surgery, and all that. So that fear is also there. So management and future directions of fibroids. So treatment options includes we have both medical and surgical approaches for to treat fibroids. So the medical ones are just to help control symptoms, but they don't permanently eliminate fibroids. You know, I'm sure you've heard, oh, if you take this medication, it will shrink fibroids and all that. Yes, it would shrink fibroids, but most times we've noticed that when that medication, when you stop that medication, it grows back. So, and that's not permanently eliminating it. It can help control the symptoms at the time. It can also help to reduce the size, but it doesn't mean that it will take out the fibroid will magically go off. The next one is do have the surgical options, which includes the myomectomy, hysterectomy, and uterine artery embolization. So all these myomectomy is taking out the fibroid alone. Hysterectomy is taking out the whole uterus, while the uterine artery embolization is just to kind of take to burn off the artery that is feeding the fibroids to stop it from growing. Before I go on, please, I just want to be sure that my students are still here and I'm not talking to myself. So I'm going to ask my assistant to please post the question. I want to know how well you know fibroids. Like before this webinar, I want to know how well you've known fibroids. Victoria, please can you help me pop it in the chat just so that I can see. So don't forget, you don't have to type everything out. You can just put A, B, C, or D in the chat. Just I want to know how well you know fibroid. I'm waiting. Oh, nice. Okay.
The responses are coming in.
Yes,
A
I'm
couple of
looking.
B's, C's.
Okay, nice.
Yeah.
Oh, so that means the topics actually, it's good we're having this conversation today because I can see that a lot of you have heard about it and you don't know much about it, while some actually have been diagnosed before and some also know someone who's affected. So I hope after today you're able to pass the knowledge out across to your friends and your family members who may have been affected. Okay, so I'm just going to continue. Thank you so much for your answers. I'll continue just so that I don't take up the time today. Okay. So the medical management I mentioned earlier is we have the hormonal contraceptives. Hormonal contraceptives actually just help to reduce the bleeding. So I'm sure if you know someone who has fibroids, they must have maybe mentioned that they don't have regular cycles, or sometimes they have longer cycles. If maybe normally you would say, okay, average should be about 5 days for your menstrual flow. But you heard the person say they've been on their period for almost 8 days, 9 days, and it's been heavy flow. And all those kind of people, when you see them, you actually see that they are so drained and so like they always get tired. They get tired easily and all. maybe they are slow and stuff. So usually give them hormonal contraceptives just to regulate the cycles and also to reduce the bleeding. So we have the GnRH analogs that to help suppress estrogen. So estrogen has been found to be the major cause of major cause of fibroid growth in the uterus. So they give these analogs to suppress estrogen. And but guess what? Like I said, it just shrinks fibroids temporarily. We also have tranexamic acid, which helps to reduce heavy flow. That's just to help to reduce the bleeding. And we have IUDs for effective local hormonal control, and then NSAIDs to give and to ease off with the pain. NSAIDs like ibuprofen, Profenac, and all. These are just to manage the symptoms. They don't actually take out the fibroids. It just helps to manage the symptoms. So then we have the surgical options, the fibroids, removal of the fibroid, and we have the hysterectomy, which is the definitive cure. If you don't want fibroids to come back again, if you don't think, if you like the permanent way of treating fibroid is actually just to take off the uterus completely. But it's the problem with that is that it obviously ends the possibility of future pregnancy. And so that means before this kind of decision is made, we have to consider the age of the person, if the person has plans of having babies in the future, and all that. That will now depend on hysterectomy. The decision would now depend on whether they're going to use hysterectomy or not. The embolization is what I told you about, to preserve the uterus by shrinking or destroying the fibroid tissue. So we have healthcare access challenges in Africa, which involves that limited access to quality surgical care. But no, we actually have good hospitals that actually do this. But it's just we're talking about Africa in general, so it's not just Nigeria. So please don't think I'm talking down Nigeria. No. So it's just the quality surgical care, inadequate diagnostic infrastructures, and socioeconomic barriers. So where in socioeconomic barriers, yes, you on this webinar may be able to afford ultrasound scan and afford to have a hysterectomy or have a myomectomy and all. But just think about those in all those rural areas who don't even have access to maybe electricity and all. They may not just if all they are facing is heavy bleeding and just fatigue, they may just decide to just leave the fibroids and just keep living their normal lives with it, enduring life with it, as opposed to someone who maybe has access to all these cares and maybe all these health access to surgical care and all, and also has the funds to fund the treatment. So we also have cultural factors affecting surgical decisions, cultural beliefs, fear of surgery, maybe if maybe they know they have a family member who went tried a myomectomy before and died. The next person in the family may not want to go ahead to have the surgery again. So there's historical mistrust, and then there's stigma around reproductive health. So all these things actually prevent affects surgical decisions. And then post-surgical outcomes and quality of life. So studies show that 72% of women report significant symptom improvement following surgery. So that means it shows the transformative impact on well-being and daily function for surgical options. So now this is another important part. I don't know if you've ever heard, I think this watchful waiting, I've noticed that they do that a lot in the Western world, because how they just say if the fibroid is not bothering the person, if maybe there's no immediate threat, they usually would say, oh, just let it be. After a while, it would shrink, and then you won't need to take it out. Actually, it's true, because as you get older, as you get to menopause and estrogen reduces and all that, the fibroid starts shrinking and you may not need to have surgery. So this is why they call it watchful waiting. So if there's no symptoms, and I mentioned earlier that we have symptomatic fibroids and non-symptomatic fibroids. Symptomatic fibroids are the ones that where you have the heavy bleeding and all. The ones that don't have symptoms, there's no urgency, so just monitor it. So these are the type of people that accidentally find the fibroid. It's maybe they went to check something else and they found out that they have fibroids. Without even going to do a scan, you wouldn't have known that you had fibroids and all. So it's if the fibroid is small size, it qualifies monitoring. Then, but for people like this, it's just all you just need to do is now regular ultrasound check-ins just to check the growth of the fibroid. The quality of life, if as long as you're not being affected, it's not affecting your work, it's not affecting your mental health, you can just do watchful waiting. And then also, if the person is already approaching menopause, there's no point because fibroids usually will shrink naturally. But if there's worsening symptoms, then definitely you will need to get it treated. This is another interesting part because a lot of people are told, I'm sure if I ask now, if anybody here has taken herbs to try to shrink fibroids, I'm sure I'll see a lot of hands up because it's a common thing in Africa. And then they will tell you, you take the herbs, and then some people would even say that they passed out the fibroids, that they saw the fibroids dropping off and all. So this is why we're talking about it. So they have the herbal shrinking claims, and these herbal shrinking claims, they actually lack clinical trial proof. There is no published research or studies that have shown that they will have shrinking herbs to shrink fibroid that would take off fibroids completely. So I mentioned earlier that there are some medications that can help to shrink it, but once you stop taking those medications, it grows back. So it won't permanently take it out. So it's just, I know that I'll have a lot of questions after this regarding this. So that's why I decided to put it ahead of time so that you don't crucify me at the end. So the potential risk of using these herbs is that if you're taking it with other medications, you can actually be hurting your organs. You can be hurting your kidney, you can be hurting your liver, because most of these herbs. So now, if you want to take, for example, if you want to take ibuprofen, they can tell you to take 400 milligrams of ibuprofen, right? I just mentioned a specific amount, 400 milligrams. But if you're taking herbs, have you ever wondered how many, like Jenny said, you can't quantify the number of whatever it is that is in the herbs that they claim would shrink the fibroids. So you can't quantify with the amount you're taking. They may just tell you, oh, take 1 cup. How many? We have different kinds of cups. We have different sizes of cups. So you're not able to tell the actual amount you're taking in. And then also, you don't even know if it interacts with the other medications you're taking. So, and all these would affect your organs. You're overworking your kidneys or you're overworking your liver. And that's why a lot of people will end up with kidney problems or liver problems. So now, another problem that comes with taking herbs is that while taking the herb, you may just be, you're tempted to kind of observe to see if it will go down. Instead of going to the hospital to get early treatment, you will now delay the treatment because you're waiting on herbs that may be harming your organs instead of actually working on the fibroid. So it's always good to consult a qualified gynecologist first. I'm not saying the herbs don't work. I'm just trying to say that there's no research that has shown or proven that these herbs work. So now we have other research on fibroids that are currently out there. So we have the chemicals that endocrine disrupting chemicals that are linked to hormonal imbalances affecting fibroids. So like chemical hair relaxers and the higher incidence in Africa in Black women. We also have hair dye exposure, frequent use associated with increased risk So these are current research that are going on now, and they're trying to see why, to know why this is happening more amongst Africans. And then we also have nutritional deficiencies, low vitamin D, and poor diet increase in the risk. We have environmental toxins and disparities, obviously targeted at beauty product marketing. And so they're obviously calling for safer product regulation and stricter beauty product standards. So vitamin D and fibroids among African women. So we have high deficiency rates in Black women. So I used to think that, okay, because we have the sun in Africa, definitely having the sun in Africa should mean that we have enough vitamin D in our body. But the interesting part is because we have melanin. Melanin is obviously what makes our skin dark. Melanin reduces vitamin D synthesis, so it reduces the absorption of vitamin D into the body. So that's why there's a strong link to increased fibroid. So what happens is that vitamin D regulates the cell growth in the body. And if you have enough vitamin D in the body, there will be low chance of having fibroids grow. So taking enough vitamin D supplements will reduce the size and the risk of fibroids. I've done extensive research on it, and I think I will agree with that. So chemical hair relaxers and fibroid risk. We have chemicals like formaldehyde releasing agents. We have the parabens and all. So we must be careful when communicating this research, because the evidence currently shows an association, but it's not a confirmed cause. Fibroids occur in many women who have never used relaxer. For example, now, if you want to check actress Lupita, like I mentioned, she had 30 initially, they took out 30, and then she came back and said that now they've grown back. Actress Lupita is not someone you would say uses hair relaxer all the time. Actually, she's always on a low cut. So if you want to use her as an example, you can. She doesn't actually represent this group of people that chemical hair relaxers actually cause their fibroid. So it's still it's not yet confirmed. They're still doing research on it. And like I said, they've not used enough African women to do this research. So that's why we are not able to say, okay, these studies are conclusive or not. So the key takeaway is that fibroids are multifactorial. So it influenced by genetics, hormones, environment, and other factors. It doesn't just mean it's only hair relaxer, or it's stop changing your beauty products and all that. Yes, you can do everything with caution, but that doesn't mean that if you stop relaxing your hair, you will never have fibroids. I just want to put it out there. So the public health priorities, we have to normalize the conversation and break the cultural silence on fibroids. Please, fibroid is not a death sentence. Fibroid doesn't mean someone is infertile. Fibroid does not mean you should call off a wedding. Fibroid we just need to just talk about it and stop making it look like it just means that the lady is no more, maybe we should just cast that out, and she doesn't deserve to have relationships and have a family like every other person would. So early screening initiatives, we should start uterine health exams earlier. So if you notice that your period is heavy, your flow is heavy, yeah, go do an ultrasound scan, and then let the ultrasound scan tell you you don't have fibroids, and then try to figure out how to now stop the heavy bleeding. But once you have heavy flow, please go do an ultrasound scan. Anemia screening too, we also have to look at it. And then we should also expand surgical training, enhance access to fertility preserving care. So when I mean expand surgical training, it just means that even in the community hospitals, as in local hospitals in community areas, they should be able to have myomectomy safely without having complications or even dying. So we should expand surgical training. We should also integrate mental health support. While if the healthcare professionals are here, if we have doctors here, when we're talking to people who have fibroids, I think we should just kind of counsel them and then explain to them, break the information down to the simplest form so that it doesn't affect them mentally, and just always understand that the information you have, they don't have it. So you may just see it as, oh yeah, you have fibroid. Okay, next patient. No, this person just heard that they have fibroids and they need to you need to explain to them that, okay, it's not death sentence and this can be solved, and, just kind of guide them through the pathway for treatment. And then we also strengthen research policy. This one is now for EH clinics. People should do research on do research on fibroids. We're using more African women just so that we can have a conclusive answer. Then the key takeaways here, we have that Africa and that fibroids is common, but it's not the Africa the fibroid is common but not harmless. So we also should check the fact that we have more African women having fibroids than the other racial groups. Heavy bleeding is a silent burden. A lot of people have heavy flow, but they just don't want to do anything about it. Fertility preservation options exist. Fertility preservation options exist. I've just repeated it again. We can have other ways of treating it without having to take off the whole uterus. We need to do more research involving African women, and early diagnosis definitely would save lives. The bigger picture of the impact of fibroids, we have loss of workforce productivity. If we have a lot of women in a particular organization complaining of fibroids or heavy bleeding and all, it will obviously reduce performance and cost economies, and it will obviously cause absenteeism and reduce performance. Maternal health at risk, increased pregnancy complications, there'll be preterm birth, and there'll be infertility risk. We also have gender equity gap, which means that women will be set back in their careers. You have less women in top positions or in organizations just because no one will want to employ someone who is going to be a burden or who's going to keep complaining. I'm tired this month, I'm not tired, I'm weak, those kind of things. So it will widen the career setback and reduce earning potential for women. It also amplifies social and economic disadvantages with earlier and more severe onset. Healthcare system strained public resources, high rates of surgical intervention, and long-term care. So all these parts, I'm just telling EH Clinic because I know that they are the people in better positions to handle this. So call to actions. Clinicians should stop dismissing symptoms. Please, if someone has heavy menstrual bleeding, please send them for scans, use validated tools, and offer evidence-based treatment options promptly. Policymakers should fund fibroid care. Please, I don't know if we have health insurance in Nigeria. We should have health insurance for so that people can actually go and get themselves treated. They should invest in community health programs and also target African women facing these fibroids so that we can observe them, do research, and kind of know if all these things we're speculating they are true. So communities should break the silence. We should challenge cultural norms that normalize severe menstrual pains and encourage open conversations. Patients should know that we have full range of treatment choices beyond hysterectomy. Having fibroid does not mean that you would take out your whole womb. No. Ask about taking out the fibroids as myomectomy, ask about embolization, and ask about the medical management. Also, just make informed decisions. Always know that you can make decisions on how you want to be treated. This is the end of my long presentation. Before we go on, please, Victoria, can you, or Victoria or Mr. Obina, can you put the question that has to do with What of the which of the following do you think indicates heavy menstrual bleeding? I just want to be sure we're all here, so I'm going to be putting questions in the chat. Like as usual, just use A, B, or C to answer my questions.
Just a moment.
Okay, so I can see everyone put all of the above. That means you're all listening. That's nice. Okay. I feel like a proud teacher now. The next question, I think that should be my last question. Mm, I think, well, please, can you put the last question? After this webinar, what surprised you the most? How common fibroids are, the link between fibroids and the fertility, the risk. Um, okay, nice.
Okay.
Mhm. Okay, so I think with your answers, I feel like I'm happy that you were able to understand some of the things I said. So I didn't really use difficult medical terms, and you were able to understand. Okay, so now I think I'll move over to Mr. Obina, the moderator. Can you
Yeah.
coordinate the questions, please?
Yeah, thank you, Dr. Ivy, for that very beautiful presentation. I think it was well delivered, and I also expect that it was clear and easy to be understood. So we have quite a number of questions, so we'll see how we can take as much as we can. Probably somebody said chooses to be anonymous. I recently had a myomectomy a month ago. My doctor described the fibroid as a 22-week size fibroid. What can I do to avoid the fibroids coming back since I was told it can come back?
Okay, so thanks for that question. So like I said earlier, because we are not so sure of the actual cause of fibroids, but the main culprit for fibroid growth is estrogen. I don't want to ask your age or ask your general health or personal history on this platform, but anything that would reduce estrogen would actually reduce the chance of it growing back. So I don't have if you've not checked your vitamin D level, if you've not checked, like you just need to. It's I need to have like a one-on-one conversation for us to know the likely cause of your particular fibroids. But it's just anything that will reduce your estrogen would help to reduce the chance of it growing back.
Okay, thank you. So anonymous, I guess you can either check with your local doctor if you're close to any of our locations. Maybe you can come to EHA clinics and see any of our doctors too. So if he says, thank you, Dr. Ivy, please, what causes this fibroid? This one, what causes it? I think
So
those
I
ones are
think
in general.
I
Yeah.
think it's almost the same question, the same to the previous question. The cause, yeah, we have different possible causes, right? Knowing the exact one would determine, like for me to be able to tell you what causes your particular fibroid, I'll have to have a conversation with you. I have to know your medical history, and that requires like having that conversation in a private place. So please, like he said, you can go to you can go to your gynecologist and ask them to. I know a lot of doctors may not have time to break down medical information to you, but specifically ask them to break it down for you. Fact, do your test, find out why you are having it before then they'll be able to explain to you the cause. So you can either go to EHA clinics, or you can go to your personal gynecology if you have
Okay.
one.
Thank you, Dr. Ivy. So another person chooses to be anonymous. Since the data shows fibroids are more common with African women, what are some effective increase awareness for prevention? Are there African research centers, organizations doing any research within with African women, since available research doesn't include African women? And then what is your take on the high rise of different combination of supplements, especially some that claim to treat fibroid? Are these supplements recommended? I hope you got all. I could take it one by one, maybe when you're ready.
I just picked the questions. So I think the
Okay.
first question was sorry, the first one was what? First part of the question.
Fibroids. Yes. What are some effective ways to increase awareness for prevention? I think a
Okay.
webinar like this is one of them. Yeah.
Yes, exactly. A webinar like this is one of them, and also to maybe at the hospitals, if doctors also can talk about it, or health nurses, the healthcare professionals can actually emphasize it. They can have um, live meetings in the hospitals. There's some community hospitals where you have maybe before each day, or maybe one day in a week, they can have a group session just to educate people on different health topics. So having heavy bleeding and fibroids can also be one of them, since it's common in Africa. So having frequent educative meetings would be very good.
Okay. And then talked about if there are African research centers, organizations that are doing any research with African women, since available research doesn't include African women.
Okay, so it's not that it excludes African women completely, but it's just that we have very few African women actually part of this research. Yes, definitely, they will have organizations doing the research, but they are very few. So it's just we're just encouraged for us to have more. Imagine having doing a research in a country like Nigeria and having the right number of people participate in it. It would be able to give a clearer understanding of what's going on, because you have more people, and that way we'll be able to break it down and say, okay, these are the number of people who used hair relaxer for a particular period of time, and these are the number of people that had fibroids and all that. So you'll be able to it'll be easy to group them, and then have a big picture of what is actually going on and the real cause. And sorry, just for me to just emphasize, it's not just hair relaxer, hair dye also has been implicated to cause fibroids too.
Okay. And then, so what's your take on the high rise of different combination of supplements, especially some that claim to treat fibroids? Would you recommend the use of supplements?
Okay, so I have a little challenge with all these supplements, because I've noticed that people don't have a proper knowledge of the contents of these supplements before taking them. So now I have an aunt who was if you ask her, she'll tell you she's so healthy, she's taking care of herself very well. I found out that she was taking 4 different supplements. Now, these 4 different supplements, each of them have zinc in them. Each of them have magnesium in them. So if you check the amount of magnesium she's taking into her body from the 4 different supplements, you now find out that she's taking more than her body actually needs. There's some that will have potassium, there's some that will have calcium and all that. And all these, all have implications in your health. We have something we call hyperkalemia. Hyperkalemia is high potassium. We have hypokalemia and all that. So having to take different supplements, you're just going to be overworking your organs. The organs like the kidney, the liver, trying to regulate all these things. You're giving it more work. Why are you packing zinc into the body what do you like, why do you need more zinc? Why do you need more magnesium? Why do you need more like that? So it's just like you're just putting so many things and complicating your health. So that's why I don't really buy the idea of all these supplements. And any supplement that comes in form of a herb without showing you the actual quantity of these things, it's also very risky because you don't know the quantity you're putting in or what you're putting into your body.
Okay, thank you. Okay, somebody asked a question. I think I can even quickly ask it. That does it mean that fibroids does occur in women over 50? I think that's it. Good.
So it means that what I'm trying to say is as you get older, because obviously the female hormones that the estrogen and progesterone they start reducing. They are the ones that help to cause the menstrual bleeding and all those things. They start reducing. There's nothing to feed the fibroid. So the fibroid will naturally start shrinking. So yes, they will have it, but it may not be symptomatic. It may just be in a smaller form, either from what they had before they got to that age. So women over 50s, they may have fibroids because they had it before and it has not finished. It has not like it's not it has not really maybe it's now in a smaller size. It's not affecting them. It's no more symptomatic. Then there's definitely you would see some of them with fibroids.
Okay. So I think this has to do with the estrogen. Spoke about reducing the production of estrogen to help reduce the growth. What can one do to reduce excessive production of estrogen?
So unfortunately, we're women, we need estrogen. Like I said, I don't want to give an advice without knowing your medical background. But there are some things that would actually distract the womb from producing estrogen, things like getting pregnant. If pregnancy, definitely, when you're pregnant, there's obviously reduced production of estrogen. So I'm not saying please go and get pregnant. No, I'm just trying to let you know the reason why they said nulliparity. People who have not had a baby before, there's a chance that they will have fibroid because the estrogen, there's nothing to disrupt or distract the estrogen from being produced.
Okay,
And
then
then
this
also
person,
we also have, sorry, we also have medications that you take that would also reduce that reduction. I mentioned it on the slide with talking about um, the medical management of fibroids.
okay. So someone is asking if there's a lifestyle modification that can prevent fibroid for one who hasn't had it or who doesn't have it. Is there any lifestyle modification apart from
Please,
break?
please go take your vitamin D,
Okay.
take your vitamin D supplements. If you've not been, trust me, a lot of Africans don't have vitamin D. I know you would hear if you hear someone say, "Oh, I took a stroll, so I'm sure I have enough vitamin D in my body." No, it's not enough. So if you can, but don't just take your vitamin D supplements and that at least would help. I keep talking about that vitamin D because I think from experience I've seen someone who it actually worked for. So vitamin D supplements are good.
Okay, someone said, is it advisable for an unmarried woman in her early 40s to take surgery as an option for treatment of fibroid?
So if someone who is not married at the age of 40 now, it now depends on their choice. If they plan to, if they, first of all, before any surgical intervention can take place, they have to check the size. If the doctor has checked the size and seen that you don't need to take out that you can only take out the fibroid, then that would also guide your decision. Yes, you can do your surgery, take out the fibroid, depending on the size and location of the fibroid. But this decision to take out the whole uterus would come from you, depending on if you still want to have kids in the future. And but if you plan to have kids in the future, taking out the fibroid alone is it's not a bad idea. And then also, if the fibroid is not causing any obvious symptoms, you can leave it and you can still have your baby. People have babies with fibroids in their womb just because if the size is not so big. If it's a small size, yes, the baby can grow in the womb. But if the size is really big, you'll have to take out the fibroids first. And
Okay.
then, sorry, just to complete that. So now remember that someone who is in their 40s is already getting close to menopause. So if it's not too big, you may just do watchful waiting, have your baby, and then let the fibroid shrink by itself. Because menopause also can help to reduce the size of fibroid.
Okay. So is there a connection between high calorie foods and fibroid growth? Catherine is asking that.
Hi, sorry, what was that? I didn't get the
Is there,
question.
okay, is there a connection between high calorie foods and fibroid growth?
So we have obesity is actually implicated in the growth of fibroids. So any food that's going to cause you to put on so much weight, I think you can generally obesity is not even good. And high calorie foods you have to be careful with that. So yes, obesity is linked to fibroids.
Okay, so this person, be fun again. Good day, doctor. Thank you for your time. I really gained a lot today. I would like to ask, I have been diagnosed with fibroid with submucosal and intramural, but the gynecologist told me that they are too small in sizes and the surgery is going to be high risk. But I experience heavy bleeding and severe painful menstruation every month. But he said there isn't anything to do about it at this point. But I wish to know if there really isn't an option.
Okay, so now the first thing the doctor mentioned is that the size is small. So if the doctor is saying that the size is small, then I would say manage the symptoms and just let it be. So if yes, you're having menstrual pain and you're having heavy flow, you can take medications to reduce the flow, like I pointed out in my earlier slides, and then you can also manage the pain. But what I don't know why, because I don't have a full picture of why he has said that surgery is high risk now. It may be linked to your other health conditions that may mean that having a surgery like that would be risky. But if the size is not so big and the symptoms you're facing is heavy bleeding, we can do the medical management, which is either using the analogs or using the contraceptives and pain medication until whenever you are ready to have kids. While you're
Okay.
doing that, you can also monitor the size just so that you're sure that it's not getting bigger. Depending why I mentioned this part now is I don't know the age of whoever is asking. If maybe they feel they are not yet ready to have kids yet, so they can just maybe monitor the growth but as they go.
Okay. So someone on YouTube says, how can one measure when menstruation is heavy or normal? How do you determine that?
Okay. I'm sorry. I thought I actually planned to kind of explain it, but I forgot. I'm sorry. Thanks for drawing my attention to that. So heavy flow, right? Um, if you just give me a minute. I have this my structure and how I calculate it. So it depends on the number of pads you change every day and how long your period lasts. So these are the things that will determine if you have heavy flow. Give me a minute. Yes. I want to give you the actual formula that I created. So heavy flow simply means soaking through pads hourly. So the frequency of which you need to change your sanitary pads. So if you maybe check with your friends, you may find out maybe they change their pads 4 hourly or between 4 to 5 hours, every 4 to 5 hours. But you now find out that every 1 hour your pad gets full. That's heavy flow. It means that you're having your blood flow is actually low. And then also if you're passing large clots. Clot is I'm trying to break it down now. Clot is when you have the blood, blood coming out in lumps. So if you're passing large blood lumps, that's clots, then that means you're having heavy flow. And then if your bleeding is more than 7 days, then that would be considered heavy flow. Finally, if while you're your period you find out you feel dizzy or weak all the time, then yes, you are having heavy flow.
Okay. So someone said, okay, the lifestyle question has been checked before, which is you said give attention to vitamin D supplements. Is that considering the cost and some likely complications or the recovery process, there are fears to engage in medical procedure. I guess that procedure will be surgery. Many seem to opt for herbal medicine. Okay, I think your presentation even handled this. There are no prescriptions as to whatever you're taking. There are no specifications as to what are the active ingredients in those drugs. So I think that's taken. Endocrine disruption agents on fibroid development. Would you want to say something about that? Could you please throw more light on that?
Okay, so these agents actually affect the estrogen production, and that's what causes fibroids to grow. So it's just these are endocrine, like they at the end of the day link to estrogen production, and then it causes the fibroids to grow and increase in size.
Okay, I think we've practically checked through all.
I think I'm seeing someone's ask if fibroid can be described as a cancerous growth.
Cancerous growth.
No, fibroid is a benign tumor. Benign tumor means it's non-cancerous.
Okay. Yeah. Yeah, I think we've handled most of our questions. Please, as you're looking at, we dropped a survey link on the chat. Please, would appreciate if you would just give a feedback, and I'm sure Dr. Ivy too would be interested in seeing that feedback. So if you can just click on the link and give us your thoughts on how the webinar went. I'd like to know if I can have your email, please, for further assistance. Okay, so so do you permit I share that, Dr. Ivy?
I think they can go check me on the DV Health Instagram page, and then if they have any question, I can always answer them through the DM.
Okay.
Or you can also share my email. It's not a problem. You can share my email.
Okay, so this person has asked again, Catherine. I want to take her question because she once nursed my son. So maybe I'm biased towards that. So what's the cost of what's the cost range for UFE? What's your opinion about this choice of treatment for women of childbearing age?
Okay, so UFE, that's uterine fibroid embolization. So it's actually it's a very good one. What happens is it helps to attacks the arteries supplying the fibroids, which obviously will affect the growth of the fibroid. It's a very good treatment, but I don't know if it's common in Africa. So obviously, if it's not so common in Africa, it will mean it may be expensive. I don't know. I'm not so sure about that cost. So, but that's why I think if we have a lot of health insurance and health insurance policies and all, we may be able to get it at a cheaper rate. But yes, it's very good for people who childbearing age. It helps to just shrink it instead of having to go through surgery. And instead of having to go through major surgery to take out the uterus. I don't know the actual cost, but it's a very good approach to treating fibroid.
Okay, so thank you. I think I'll take this one, perhaps the last. What would you say, Olua Grace is asking, what would you say about someone who's been diagnosed with PCOS and fibroid?
So PCOS and fibroids, they are hormone, both they all have one common this one common factor, which is hormone. PCOS is a hormonal condition, and also the estrogen, like I said, fibroid is a hormone receptive tumor. So everything that has to do with hormones would affect PCOS and will cause can also cause PCOS and cause fibroids. So it means that the person's hormones are actually jumping all over the place. So looking and focusing on treating that would also help to reduce the fibroid growth and also help to manage the PCOS.
Okay, so I think we've covered most of the questions, and so that
Ooh.
we don't drag and drag because I know it's an issue that people keep asking and asking and asking questions about it. But then, so you could use the feedback to drop any other questions that are remaining, because as part of the questions on the feedback, we have other things that you think you would like to know, and maybe we can get Dr. Ivy to come again. Dr. Ivy has written a book. I'll give her just 1 minute to talk about it, because for those of us who attended this webinar, there's a possibility of getting that book and reading further. Please, Dr. Ivy, would you say something about your book?
Okay, so I recently wrote a book on it's called It's My Bleeding Normal. So the book is about everything that has to do with bleeding in women. And let me just show you. And it's currently going around now it's just everything you want to know about bleeding. And it will also tell you what's normal and what's abnormal. And then also tell you the possible and tell you other causes of bleeding, like cervical cancer and um, pelvic inflammatory disease and all that. So it's just everything you want to know about bleeding and in women. Just from what he just said now, I think I would be able to give out this book to, I don't know, I'll just leave it to you, Mr. Obina, to decide who will get it. I can give out this book to 10 people who joined today. So
Okay.
I'll leave it up to Mr. Obina to decide how we're going to give out the book. But
Okay.
I'll be giving out 10 of it today.
All right. So so maybe I would say the first 10 survey responses I see, I'll give out the book to. And so I hope to get the number from them. And then when I check the attendance too, maybe the first 2-3 people I could also get. So maybe I'll take 7 from the responses and then the first 3 to join. All right. And or I'll add 1 more to somebody who has asked the question. All right, we'll find a way to give out those 10. But thank you very, very, very much, Dr. Ivy, for this exhaustive. I didn't hear anybody compliment that her slides were beautiful. You know, the slides, because all of us at the background, when we were looking at the slides and preparing, everybody commented that the slides really were beautiful and they were engaging, because sometimes I found myself looking at the pictures while you were talking. So
Thank you.
I think we appreciate that. And thank you for giving us the privilege to speak to us today. I'm sure a lot of us have learned a couple of things. Your Instagram handle has been shared, so you may have a couple of people from this webinar reaching out to ask more questions. Thank you so very much. And for us from AHA Clinics Academy, of course, you know, we're a subsidiary, we're part of AHA Clinics. We have our locations in Abuja, Kano, and in Lagos. So if any of the things that has been raised today issues that concern you, you can come to any of our locations. We're talking about this because it's an area we are also interested in the clinic. Or if you have any reliable health centers around you, you could go for a check. So painful menstruations, don't normalize it. Heavy bleeding, please don't normalize it. You know, Africans seem to want to get a trophy for pain threshold. You know, it's like it's normal to endure pain a lot, but then there's no point. And that, like the doctor told us about the actress, sometimes we may be the issue with fibroids is because there's a delayed, presentation to the clinic, all right, and then it has turned to, meanwhile, perhaps it would have been arrested earlier or something would have been done. But please give attention to yourself. And I personally say, ladies, you're important to us. You are wives, you are daughters, your sisters, and you just make the world beautiful. So we want you here for a longer time and living, painless and stress-free lives. So until we come your way again from AHA Clinics Academy, this is bye-bye from us. Thank you very much, everybody, for joining. And thank you, Dr. Ivy.
Thank you. Take care.
Yeah. Bye, everyone.
Thank you. Bye, everyone.